NCLEX 480 Exam 2. Question 1. What are common pulmonary complications of a coronary artery bypass graft, CABG, myocardial infarction and angina? Pulmonary complications, such as atelectasis and PNA, pneumonia, gastrointestinal bleeding and ulcers, renal failure and liver cirrhosis. Pulmonary complications, such as atelectasis and PNA. Question 2. Decreased cardiac output, hypothermia, electrolyte disturbances, K and Mg depletion, neurologic defects, clots, and stroke can all lead to abnormal heart rhythms. What are these abnormal heart rhythms called? Infarctions, murmurs, dysrhythmias, ischemias. Abnormal heart rhythms are known as dysrhythmias. Question 3. What does the conduction system of the heart do? It pumps blood into the aorta. It prevents the backflow of blood between chambers, starts electrical impulse at sinoatrial SA node and sends it through the heart tissue to get to the atrioventricular AV node. It then travels through the bundle of His to the Purkinje fibers, causing ventricle contractions. It oxygenates the blood in the lungs. Starts electrical impulse at sinoatrial SA node and sends it through the heart tissue to get to the atrioventricular AV node. It then travels through the bundle of His to the Purkinje fibers, causing ventricle contractions. Question 4. What happens when the vagus nerve is stimulated? Increase HR, decrease HR, increase stroke volume, vasoconstriction. Decrease HR. Question 5. What happens if the sympathetic nerves are stimulated? Decrease HR, vasodilation. Increase HR, bronchoconstriction. Increase HR. Question 6. Which of the following describes depolarization of cardiac cells? Closing of Na plus channels and opening of K plus channels. Na plus moves into the cells, making the inside of the cells positively charged compared to outside. Ca2 plus moves out of the cell, making the inside negatively charged. K plus moves into the cells to stabilize the membrane. Na plus moves into the cells, making the inside of the cells positively charged compared to outside. Question 7. Which of the following describes repolarization of cardiac cells? Na plus moves into the cells, making the inside positively charged. Closing of Na plus channels and opening of K plus channels, cells become negatively charged again, heart is relaxing. Ca2 plus influx causing sustained contraction. ATP is consumed to build muscle fibers. Closing of Na plus channels and opening of K plus channels. Question 8. On an EKG, what does the P wave represent? Atrial depolarization, ventricular depolarization, atrial repolarization, ventricular repolarization. Atrial depolarization. Question 9. On an EKG, what does the QRS complex/interval represent? Atrial depolarization, depolarization of both ventricles, ventricular repolarization, SA node firing. Depolarization of both ventricles. Question 10. What is electrocardiographic monitoring? Measuring blood pressure via an arterial line. Graphic tracing of electrical impulses produced in the heart. Listening to heart sounds with a stethoscope. Ultrasound imaging of the heart valves. Graphic tracing of electrical impulses produced in the heart. Question 11. What are the steps to analyzing an EKG? 1. Determine HR2. Determine if rhythm is regular/irregular. 3. Determine P wave regularity. 4. Measure PR interval. 5. Measure QRS duration. 6. Examine ST segment. 7. Assess T wave. 8. Measure QT interval. 1. Check BP. 2. Check HR. 3. Look at T wave. 4. Measure PR. 5. Examine QRS. 1. Find P wave. 2. Find QRS. 3. Evaluate ST depression. 1. Determine axis. 2. Find hypertrophy. 3. Look for ischemia. 1. Determine HR2. Determine if rhythm is regular or irregular. 3. Determine P-wave regularity and shape. 4. Measure PR interval. 5. Measure QRS duration. Check consistency and appearance. 6. Examine ST segment, depression or elevation. 7. Assess T-wave. 8. Measure QT interval. Question 12. On an EKG, ST elevation typically indicates what? Normal variant. Cardiac injury. Me, myocardial infarction. Hypokalemia. Me. Question 13. On an EKG, ST depression typically indicates what? Me, myocardial infarction. Cardiac injury, ischemia. Hyperkalemia. Pericarditis. Cardiac injury. Question 14. Describe normal sinus rhythm. The SA node fires irregularly. There is no P wave before the QRS. All PQRST components are normal. The QRS complex is widened. All PQRST components are normal. Question 15. Describe sinus arrhythmia. The heart rate is consistently above 100 bpm. The heart rate is consistently below 60 bpm. There are extra beats arising from the ventricles. Like normal sinus rhythm, but SA node fires irregularly. Like normal sinus rhythm, but SA node fires irregularly.